Shocking research. Many heart attack victims showed warning signs weeks before, but they were missed. Recent studies have revealed something deeply alarming. Many people who died from a heart attack had shown early warning signs that were overlooked at the hospital, sometimes just weeks before the event. As a doctor, I've seen too many older adults unintentionally ignore the subtle signals their bodies were trying to send. This video is here to help you listen to your heart before it's too late. With years of experience in cardiology, I've witnessed firsthand how recognizing the early signs of a heart attack too late can lead to heartbreaking outcomes, especially for those in our age group. The truth is, a heart attack in seniors often doesn't look like what we expect. The heart attack symptoms can be vague, unusual, and easily brushed off as normal signs of aging or minor discomfort. But those quiet signals from your body could be your only chance to act in time and protect yourself. Many studies, including one conducted in the UK that I've referenced before, confirm just how crucial this awareness can be. In this video, we'll break down the most overlooked signs of heart attacks. We'll explore why they're often missed, what makes them different in older adults, and most importantly, how you can take control by learning to listen closely to your body and safeguard your heart. Your heart matters, and knowing how to spot its quiet cries for help might be the most important thing you do for your health today. Many people still believe that a heart attack always starts with someone clutching their chest and collapsing in pain, just like in the movies. But in reality, especially among older adults, heart attack symptoms are often quiet and far less dramatic than we imagine. Because of this misconception, many important warning signs of a heart attack are sadly overlooked. I remember the case of Alison Fillingham, a 49-year-old nurse. Even though she worked in healthcare, she didn't think she was having a heart attack when she felt a dull ache in her neck and collarbone. There was no chest pain, no tightness like in the textbooks. In fact, she was initially misdiagnosed with a panic attack. She later said, "I always thought a heart attack meant clutching your chest, but that wasn't what happened to me." Fortunately, further tests confirmed a heart issue, and she was treated in time. Her story shows that even trained professionals can miss the signs when they don't fit the classic picture. As we age, our bodies change. The nervous system becomes less sensitive to pain, so the feeling of a heart attack may no longer be sharp or obvious. This is especially true if you have diabetes. The disease can damage your nerves, which means heart attack symptoms may show up in unexpected places like the neck, back, shoulders, or upper stomach. And sometimes there's no chest pain at all. According to the UK's National Health Service, this happens more often in women, older adults, and people with diabetes. So instead of waiting for a textbook chest pain, pay attention to your body. Symptoms like unusual fatigue, shortness of breath, chest discomfort, pain that spreads to the shoulders, neck, or back, nausea, dizziness, cold sweats, insomnia, or a strange sense of anxiety that feels like a panic attack. These could all be early signs of a heart attack. These signs might be subtle, and they might come and go. But if they repeat or seem out of the ordinary, please don't ignore them. They could be your heart's final warning. We often think of a heart attack as a sudden crushing chest pain, followed by collapse. But in older adults, the heart attack symptoms can look very different. Sadly, many early warning signs are missed not because they're not there, but because they're too subtle to notice. Many people experience unusual fatigue, shortness of breath, or chest discomfort, and quickly assume it's just part of aging. A little tiredness, a brief shortness of breath, or a dull ache in the shoulders, neck, or upper stomach often gets blamed on indigestion or joint pain. Especially when these symptoms come and go without a clear cause, they seem harmless. And so they're ignored. The mindset of older adults can also make the early signs of a heart attack easier to overlook. Some don't want to worry their family, so they stay quiet. Others convince themselves it's nothing serious. They say things like, "I'm fine, it'll pass." And because their mental image of a heart attack involves only intense chest pain, the more subtle signs like nausea, insomnia, anxiety, or long-lasting tiredness are never linked to the heart. Even for doctors, recognizing these signs early isn't always easy. A study in the UK found that 1 in 6 people who died of a heart attack had visited the hospital within 2 days before their death, but their condition was not identified in time. One of the biggest dangers is a silent heart attack. There's no chest pain, no clear signs, and it's especially common in people with diabetes. Nerve damage from diabetes can dull the body's ability to feel pain, so the heart sends no obvious signal when something is wrong. Understanding these barriers is the first step to making sure we don't miss even the smallest warning signs of a heart attack. Because sometimes the quietest signals are actually your heart's way of crying out for help. Now that we understand how subtle and easily missed heart attack symptoms can be, I want to highlight the most important factor in saving lives' time. In medicine, we have a saying, "Time is muscle." When a coronary artery is blocked, oxygen-rich blood can no longer reach part of the heart muscle. Within just minutes, the cells in that area begin to die. If we don't act quickly, the damage spreads. The heart becomes weaker and loses its ability to recover. Research shows that irreversible damage can begin within 30 minutes, and half of all heart attack deaths happen within the first 4 hours after symptoms start. But if you recognize the early signs of a heart attack and take immediate action, something truly powerful can happen. Getting treatment early can dramatically reduce heart muscle damage, increase survival, and lead to faster recovery with fewer complications. Life-saving treatments like clot-busting medication or a stent procedure work best when done quickly during that crucial early window right after the first symptoms appear. If treatment is delayed, the consequences can be devastating. Once part of the heart muscle dies, it cannot grow back. This can lead to chronic heart failure, ongoing unusual fatigue, shortness of stimme, and a higher risk of death from arrhythmias or a repeat heart attack. That's why if you or someone you love experiences strange symptoms like chest discomfort, shortness of breath, nausea, or unusual tiredness, call emergency services right away. Don't wait. Don't try to drive yourself to the hospital. With every minute that passes, your heart is crying out for help. And sometimes acting just a few minutes faster can save an entire part of your heart. Now that we understand the less obvious heart attack symptoms and the life or death importance of recognizing them early, the question becomes this: what can you do to protect yourself? The answer lies in being proactive, and trust me, that power is in your hands. First, think of your doctor as a trusted partner. Never hesitate to ask about the warning signs of a heart attack, especially if you have conditions like diabetes. Don't brush off small symptoms as nothing to worry about. Many heart attacks have been caught early thanks to what seemed like minor complaints. More importantly, become an expert on your own body. No one knows how you feel better than you do. If you notice unusual fatigue, shortness of breath, or any kind of strange chest discomfort, don't ignore it. Your instinct, shaped by a lifetime of experience, might just be the earliest doctor you'll ever have. Share this knowledge with your family and loved ones. When your children or grandchildren understand the early signs of a heart attack, they'll know how to support you and respond in time. And remember, being prepared is always better. Keep a personal medical info card, have aspirin on hand if your doctor recommends it, and make sure there's a clear emergency plan in place. That plan could be your shield in moments of crisis. Beyond what each of us can do, the healthcare system and our communities must step up too. Doctors need better training to recognize subtle symptoms. And we need public awareness campaigns that help older adults and their families stay alert and informed. And finally, please don't let fear or pride hold you back. Seeking help early is not weakness, it's wisdom, it's courage. Your heart has been with you your whole life. Now it's your turn to stand by it and protect it. My friends, I truly hope that after today's message, you have a clearer understanding of why the early signs of a heart attack are so often missed, especially among older adults. Whether it's due to hesitation, fear, or the quiet nature of a silent heart attack, all of these can lead to dangerous delays in seeking medical help. Please remember this: listening to your body is not optional. It is essential. Never take heart attack symptoms lightly, even if it's just fatigue, shortness of breath, or a dull chest ache. Recognizing the signs early and acting quickly can save your heart and your life. Stay connected with our channel to keep learning practical, science-based health advice that's simple, relatable, and made for everyday life.